If you struggle with back pain, this is going to be one of the most important videos that you watch all year. The most frequently asked question that we get here in the clinic is, what caused this? What caused my back pain? So what we're going to do now is a deep dive into the causes, the 3 most common causes for chronic back pain. We're going to give you the details on exactly what it is and then how to get out of it. And if you really understand it, then you can keep it from coming back and being a chronic problem. Let's get into it. Oftentimes people come in, they say, hey, I've just got a bad back. Well, I have 2 bulging discs in my back, but it doesn't bother me. But this is what I've dedicated my life to. So it's really important that I teach you the things that we understand about the back and what really helps with our clients here in the clinic. And so having a bad back is really about movement patterns. How do we load it? We have to really have an understanding of how that happens and how we frequently go in and cause stress on our back. And if we don't redistribute that load, then it's constantly getting inflamed and irritated. And that's where people continue to have chronic problems where they tweak their back and they're down for a week. If that sounds like you, then this is going to be a really important video and really helpful for you. So bad movements and overuse in the low back is what we see very frequently, but there's some major things that we want to talk about. If you constantly move through one area, so at our back, if we break down the body, the neck is exposed and the low back is exposed. And then we have the rib cage, the shoulder blades, all these joint capsules, all these muscles around it. This is going to get inherently stiff. And so this is exposed. We see bulging discs in the thoracic spine, but not very often. Most of the times we see them in the neck and we see them in the low back. And that's because this is exposed. We just have muscles around it. So this is going to get really stiff. So we need stability here, we need mobility here, we need stability here, and we need mobility here. But also with the hips, we want to keep our Superman and Superwoman emblems stacked over our belt buckle as much as possible. So I want to be driving through the hips. I don't want to be twisting and moving. I don't want my primary mover to be my low back. We'll dive a little bit deeper into that further in the video. The number 1 reason is repeated movements, constantly moving through the same area over and over. If I'm bending over at my back and lifting back up, so a lot of times people will have trouble with their knees, and so they'll keep their back straight and they'll just bend through their knees. So they're constantly putting pressure on their knees, but they're taking it off of their back. And that's happening unconsciously. They're just being careful with their movements. If we have pain in our knees, then a lot of times people will just bend with their back. And so we're just bending over and over with our back, reaching over to the side. A lot of our clients have pain in the car, and so they're in a seated position and they're just shifting at their low back. They can't really shift very much at their hips when they're in the car. So we don't want to move through that constantly, and that repeated movements is going to be one of the biggest things. So we want to get a little bit deeper in repeated movements and what we see most often. Bad lifting mechanics, bending through the back and lifting up through our back, that's going to be one of the problems, but the majority of the time, one of the worst cues that I hear in exercise is when somebody tells you to keep your head up. So if we keep our head up, then our back is an extension, so our body's going to follow with whatever our head and our eyes do. And so what we want to do is keep our back in a neutral position, so we keep our face in neutral as we come down. And so now I can load through the hips more and limit that in my back. When we talk about bad movement patterns, the biggest issue with it is that we are primarily moving through our low back. So our low back leads the motion, it leads the movement, and we don't want that. And that happens just easily with the way that we put stress on our back and our hips throughout our daily life. We get stiff up here, we get stiff down here. So then our low back is the path of least resistance. So we want to change that. We want to think about our primary mover being our hips, and then our stabilizers in our back. We still need that stability in our abdominals, in our low back, but that's a stabilizer. It's not our primary mover, and so we don't want to train it that way. When we have stress constantly happening on our back, we need to unload that area. So by moving in other areas, we're able to redistribute that stress, and that allows us to get healing. So, and also sleeping in good positions. We'll talk more further in the video, but staying in good positions for the majority of the day and then loading through the proper areas, more through our hips. These are our drivers through the hips. So we want to have our power coming through our hips consistently. If you can reinforce that on a daily basis, then you're allowing the healing process to happen because we don't keep re-inflaming the tissue. One of the biggest issues we see in all the disciplines that are trying to avoid surgery and keep you up and mobile is that a lot of times they'll do repeated movements through the same area. So that area is irritated. We have stress in it. We got irritation in our low back right here. We're constantly moving. We have a hypermobility at L4, L5. That's the most herniated in the low back. And then C5, C6 in the neck. those are pretty low. So if it's really low area, it's because we have a stable base right underneath it and we're stable right underneath this. That area ends up being a hypermobility. What we want to do is unload that stress by redistributing it above and below. We don't want to be doing repeated motions. And I've had a client come in and she could barely sit up because she was having so much neck pain. And so she was laying down for about 10 hours a day because it was so irritated. She went to physical therapy and I said, well, what are they having you do? Because it wasn't successful. We wanted to establish that is 100 of these, 100 of these, and 100 of these. And I said, that's the worst thing that we could be doing. So an area that's stressed and irritated, we're just moving over and over in it, and that's getting more irritated over time. So there is a point that we want to redistribute and reload that area, but it's not right in the beginning, not when we're inflamed. We want to decrease the load and allow the healing process to take place. Repeated movements often happen in the gym when we have load on our body. And so what we see often is if somebody is doing a plank, they're laying on the ground doing a plank, is that they let their back hang in this position. Okay, and then also crunches. Like doing crunches, we're just bending through our low back over and over. What we do is train a stability position, a lot of Pallof presses, where we're maintaining stability. We'll move other appendages, but we maintain stability in the core, and we're retraining that. Another thing is when people are doing hip flexor stretches. So the hip flexors tend to get really tight, and we've talked about that in a few of our videos. The hip flexors are tight, and then we come up and hyperextend in our low back. Well, that's not good for our back. So we want to keep a neutral position for our spine while we come into a hip flexor stretch, and then we want to squeeze the back glute. That gives us reciprocal inhibition. So I feel a really good stretch by firing my glutes and keeping my spine in a neutral position. Repeated movements can really be broken down into fidgety movements too, and we see this a lot, that somebody's standing around and they're just kind of wiggling and doing this side to side. So we're just causing that stress to keep taking place. I've also seen this where somebody tilts onto their toes and they're drifting up, so they're constantly just moving through their back and they're reinforcing a bad movement pattern where they're reinforcing irritation, and so they can't get themselves out of pain because they've never decreased that stress. We want to be thoughtful of that. If somebody's fidgeting, we talk about just shifting from hip to hip. So then you can get the fidget because it's unconscious, but we got to retrain our brain to do that. Make a comment and let us know some of these fidgety positions that you're getting in, because we've most likely seen it before here in the clinic, and we have some different variations of things that you can do that wouldn't cause stress. With fidgets and things like that, those are habits. And so we always need to establish habits aren't really broken, they're replaced. And so we always have to be thinking of ways that we can get a positive habit to help us and stop doing the negative ones, but we got to be able to identify what the negative ones are. Make sure you subscribe to these videos because we're going to be coming out with more and more content specific to what you guys need so you can get yourself out of pain. Another repeated movement that people do a lot, we call it the sexy walk. So when somebody's walking right here and they shift from side to side, right? So they're moving through their low back, and that's going to cause irritation consistently while they're walking. So we want to limit that as much as possible, and we do it by developing our hip strength, and then we're trying to stay in the middle as much as possible. So I want to keep my core a little bit tight, but I don't want to be over tightening my core all the time and not allow movement to happen. But primarily it should be coming through the hips, and I should have stability in my abdomen, about 80% and 20%. Number two is prolonged postures. So we talk about getting a little captain in them. So somebody who has up like this off to the side and they sleep in this position, mountain climber position. So it's a very comfortable position to sleep in. But if we are in this position for 6 to 8 hours throughout the night, then we're twisting up and putting pressure on our facets on the outside of the spine, the sides of the vertebra, and that's going to cause irritation. So we want to stay in as neutral position while we're sleeping as possible. Another thing that people do is when they're standing is that we'll tend to drift onto our toes. And when we're drifting onto our toes, you see that my back goes into extension. So I'm activating those back extensors to keep myself upright. So what I want to do is just shift my weight closer to my heels. And then now I'm neutral through gravity and I'm loading my spine in a much better position. Another prolonged position is a slouch. So like sitting in the car and just slouching down like this. If you're doing that to get out of pain, it's best to get our butt up against the back of the chair and have some stability for our low back and our hips. But slouching all the time is inflection, and that's where disc bulges typically happen, is by sitting in flexion too much. But we're also reinforcing, we're making those ligaments looser in that area in the connective tissue, the joint capsules. We don't want to do that. We want to have good connective tissue that's not being stretched all the time. We need to maintain that mobility, but we shouldn't be in it for multiple hours throughout the day. Now we all stand on one leg the majority of the time. So whatever your dominant leg is, we just have a tendency to kind of lean over to the side. Our body is energy efficient. We're trying to conserve as much energy as possible. And so just leaning on one leg isn't inherently bad, but if you're in a pain pattern and your back is irritated, you'll notice that it causes more irritation and your brain starts running wild trying to figure out, is this the thing that's causing this problem? What we've found is that it's a culmination of things. And so really understanding this stuff is going to help you a ton because you're going to be able to eliminate some of the bad things and then fill it in with really good things to keep you in neutral and make sure that you're healing. Another one I see often in my wife, she'll be leaning up against the countertop and she'll be twisted over to one side like this. So that would be a prolonged posture where we're just twisting up in the back. And so we want to be aware of it. You don't have to be perfect all the time, but when it's irritated and your inflammation levels are high, then we want to limit that as much as possible, get in neutral and then train in neutral. Number 3 is accidents and trauma. Those are things we really can't do much about. If you're in a car accident, if you play sports where you're running into people, you're falling down, those things are going to cause trauma over time. And some people have some chronic back issues because of that. But if you're practicing good prolonged positions, good prolonged postures, and good repeated movements, we're loading through the hips, we're loading through our thoracic spine, we're keeping ourselves mobile and stable in the right areas, and we're training that consistently, then we can overcome a lot of these accidents and trauma. Now, surgery is necessary sometimes. Like we have to have surgery sometimes, but it has to be conclusive. We've had clients that came in and had surgery and their pain didn't go away. So the area of pain was actually the symptom. So having a bulging disc was a symptom of a problem that we were loading improperly. And if we establish that, then getting rid of the way that we're loading and allowing our body to get rid of that inflammation, that's what's going to help us a ton. And we have to establish that even if you did need surgery down the line, we still have to fix that problem, because even if you have the surgery, if you have a piece of that disc cut out or you have a fusion, which is not a great surgery, we'd try to avoid it at all possible because we end up moving too much in the areas right above and it is a cascade effect. So we want to avoid that. But people will still have pain. We see them in here all the time where they still have pain even though they had the surgery because they didn't learn how to load their body better and take some of that stress off. Also, it's really important to understand the surgery that you're having and what the implications are later down the road. So actually talking to your physician and asking him, what are the things, what are the success stories, and what are some of the negative things that you've seen in the past? What can I be expecting? What does your rehab look like? And making sure that you're getting involved in that process, because the best advocate for your health is you. We have to make sure that we're doing the right things for our body and making good decisions, because after surgery, we really can't go back on it. So we want to make sure we turn over every stone and we're loading the body properly, and that the surgery is necessary, and then exactly what the surgery is, because sometimes decisions are made when you're put under. We want to make sure that we have all the information going in. Making these changes can be a struggle, so let us know in the comment section what you need more details on, how you need more support, and we're here to help you. Make sure you like, subscribe, hit the bell notification, because we're going to be coming out with videos based on the comments and the information that people need. Also, check out the videos here listed on the screen. They'll give you more information on the positive changes that you need to make, whether it be stretching or exercises. See you in the next video.